Great. Well, welcome and thank you for attending today's session of TMF eTMF Audit Strategy. My name is Donna Dorzinski, and I will be your presenter today. Today, we're going to be looking at the value of the TMF Reference Model and helping you organize your audits to help you identify GCP non-compliance within your TMF. We'll look at strategies for conducting an audit of the TMF that will allow you to use some of the capabilities within your eTMF, and we'll talk about auditing a TMF with focusing on artifacts that really impact the quality and GCP compliance of the TMF. I'm Donna Dorzinski. I have been in the business a pretty long time. I spent 15 years in large pharma in clinical operations, and I spent the last actually 15 years as an industry consultant working in areas of compliance with a major focus on inspection readiness and TMF. I am an experienced compliance professional, having done multiple audits over the years at both the site, sponsor, and vendor level. I chaired the reference model Section 4, Zone 4, and have served on several of their committees, and I have experience with 21 CFR Part 11 and validation. So I wanted to start with a definition of the TMF. The TMF is a standalone set of documents that really shouldn't require any additional explanation, and it really should be able to stand on its own. So a really good TMF doesn't require that individuals that conducted the study support the story of the study. So basically, your TMF is your story. It's made up of a lot of chapters that tell the good, the bad, and the ugly. And I think that's something that people are sometimes afraid of, to allow their TMF to call out the issues that might have occurred during the study. It's a collection of documents that allows the regulator to assess the conduct of the trial, the integrity of the data, and whether the trial was conducted in compliance with GCP. A health authority inspection is really focusing on those three key elements. And if you think about it, everything they need to understand about the conduct of the study should be contained within the TMF. So what the TMF is a collection of output from all of your functional areas. I think this is really important because historically the TMF has been a clinical operations set of documents, and that is most definitely not the case. The TMF today is the complete story, from data management, CMC control, biostatistics, regulatory. Every aspect of the development of that particular trial is within the TMF. I'd like to talk a little bit about current regulatory requirements because, after all, an audit is about assessing compliance with these requirements. So one of the first things that's part of our current regulatory requirements is a well-defined comprehensive content list. And so what that is it's a list of all of the different types of content that are within the TMF. It's not an inventory, so it's not intended to be a list of all of the documents that are in there, but a list of all of the different types of documents. It's intended to help the inspector actually be able to understand where the content is actually being held. Our regulatory requirements also require a comprehensive TMF management process, a process that begins at the start of the study and concludes at the archive of the TMF. And so there has to be a process for establishing your TMF, ensuring control and completeness of your TMF throughout the life of the study, securing that TMF at the end of the study, and then archiving. And then the last expectation is that your TMF be, quote, inspection ready at all times. So I'd like to talk a little bit about the historical approach to a TMF audit. And I'm talking about audit here. So I'm not talking about the routine completeness review that's done throughout the life of the study, but I'm talking about an audit of the TMF to understand if the TMF was managed in compliance with all of the things that I've just mentioned. So historically, an audit of the CRO TMF was done by the sponsor at the end of the study, right? The study concluded, the sponsor says, okay, well, I better send an auditor out to make sure that my TMF is complete, okay? So it really was about sending somebody out for a couple of days to assess if a TMF is complete. In order to assess truly if a TMF is complete, it takes a lot more than a couple of days, right? Because there's no way in a single audit you're going to be able to say, yes, I have a complete TMF. What you're able to do in an audit is to say, yes, all of the parties involved maintain the TMF in alliance with how they said they were going to do it, right? And so, yes, you do identify gaps in completeness, but generally, if you identify a gap in completeness, it's because the TMF wasn't maintained as it was intended to be maintained. So this old way was this concept of we'll look at the core files, we'll pick out some core files, so we'll make sure the plans are there, the protocols are there, the ICFs are there, and then we'll look at a couple of sites and we'll say, yeah, the TMF's good. That was my audit of the TMF. For the most part, we based it on the essential documents that were part of ICH E6, and so we just went in to check that they were all there, and we said, yes, the TMF I've audited, and it's either got issues or it doesn't have issues, right? And so a lot of times the auditor would go in and say, yeah, well, these documents were missing. I was missing this set of documents. And then the sponsor would go back and say, okay, make sure those documents are in the TMF, and then they would bring the TMF in-house.